Hey guys, Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. And we have Sky with us today. Sky, how'd you end up finding me originally?
I just looked around online, so I didn't really have any other options, and I was just in a lot of pain, so I was trying to see what was out there, and you guys just popped up first thing.
You've been suffering with migraines and headache pain for years. How many years?
Since I was a kid, but with these specific ones for the past 4 years.
Past 4 years has been the worst period of time, and you've tried a lot of different things, correct?
Yeah.
And so far, you came in on a scale of 1 to 10. You were at a 10 coming in here. In fact, I had to shut the lights down. I think I remember closing the blinds or something with that, right?
Yeah.
I mean, it's debilitating. It's affected your whole life. And now, where would you say you're at on a scale of 1 to 10?
I'm at a 0 right now.
Today's a 0?
Yeah.
Okay, that's even better than last time. I wasn't quite expecting that because I know we were kind of hanging around 2s or 3s or 4s, and then we had some episodes where it was a really big flare-up. And this is it's like our 5th visit, isn't it? Or 6th?
Yeah, it hasn't been very many, but it definitely made a huge improvement.
Huge improvement, and you didn't really know what to do.
No.
So guys, when you're suffering with migraines, headaches, neck pain, debilitating, in fact, we even briefly talked about, even if we didn't have some improvement, getting some updated imaging so we can see what's going on and see the mechanics of the spine, how that's affecting. But so far we've taken the conservative route, and so far so good. So I'm going to take you through and look at some of the processes and procedures, especially last time I started doing cranial bone adjusting with him, which is a really big thing. I don't think many docs are doing that. You get to see firsthand some of those things that I'm doing and checking and adjusting on him. So this is really impactful for him. He went from a 2 or 3 down to a 0. I haven't heard that so far with him. And now we're looking for that frequency between the visits where the treatments are lasting longer for him. So, all right, good job. Now he wears flip-flops a lot, so it makes it hard for me to do super accurate checks. It's better when the shoes are on for me. Sometimes you'll see me do checks at the feet, but also checks can be done at the base of the head. And I'm feeling for the tension and how much tension there is on one side versus the other. So I can feel, especially on the occiput, that's a back part. So there's cranial plates and bones that are involved inside the head. And I'm adjusting straight posterior, now lateral on this side. When you get the headaches, is it more in your left or your right?
The left side.
Yeah, on the left side, just the last area where we adjusted. And it's locked up still in here. Are you okay?
Yeah.
Take a deep breath all the way in, release it all the way out. We're going to do some testing where I'm at the side of the head, and there's a bone called the sphenoid bone, and inside that bone contains one of the master glands called the pituitary. Turn your head all the way to the right for me. I'm going to show you where that bone is in position, and actually I should have brought my charts in for you guys. So the adjustment here, he has both sides of the sphenoid where it's gone forward. So I'm taking it back. I'm using my finger. Let's have you turn the other way. Same thing here, using my thumb, adding pressure, head back to the middle. And usually with the sphenoid bone, we'll see also the temporal bone, right up at the top here. And we pressure tested the parietals. That's the 2 that come up this way. Right leg went slightly short on that side. So you can use leg length, or you can use, as the chiropractors, you'll see them pressure checking that area. So I'm adjusting the parietal, top here. Do you ever get into the front of your head as well?
Yeah.
Okay. And now we're starting to adjust the suture here. This is called the sagittal suture, right on here. So the bones constantly move in the head. They're called cranial plates. Let's have you lay on your back for me. Adjusting the frontal bones right here, and then face down again. So a lot of big treatment for him. Using the instrument, we can use our hands, you can use different tools to affect that area, I like to use the ArthroStim. It's gentle. Have you found it gentle
Yeah,
and easy?
yeah, definitely.
Okay, we're adjusting right at C7. And one of the big ones on him as well here, C1 posterior, and he had a posterior, right, lateral, and inferior. You can see the angle of the instrument. Take a breath in, release it out. Some big changes for you. Tender,
Just a little bit.
a little bit. So we're right at T6, adjusting right at the spinous. Is that tender there?
Yeah, it's a little up.
All right, leg check. I want you to raise your right leg without bending the knee. Back down, try the other one. Back down. Sacrum, femur bone, lateral, and from anterior to posterior. I want you to lay on this side for me. Bend right here, this top one. Good. Let me have that arm. Excellent. Good. On your back. And we're going to be adjusting right. A little lower, right at T8, T9. Take a deep breath, release it out. Good. And breathe. How you doing? Good, good. I'm going to have you come around this way. Nope, you stay right there. Lift your head for me. Good. And this was another big thing where we did a gentle traction. There we go. Open that up. A lot easier. All right, I'm going to have you sit facing the chair to your left for me. Nice arch into the lower back. And more balance. So you're feeling the tone of the muscles, you're feeling the area where the vertebrae sits, and a lot more balanced in there. All right, adjusting T1, T2 ribs. Take a deep breath all the way in and release it out. How's that compared to when you first came in? Much better? Yeah. Anything you want to share with your experience here and getting adjusted, and you want to share with the audience?
It's just been a life-changing thing where I went from not being able to work or even have a daily life. I've just been stuck at home in pain, just waiting for it to stop, and it just got to the point where I couldn't deal with it anymore, and I found this, and it's been the only thing that's made a change in the past 4 years. Doctors and hospitals haven't done anything for me. Medicine hasn't done anything. It's been the one thing that's actually made a difference in my life.
The biggest thing, life-changing, and people, you know, by you doing this, Guy, you know, I don't videotape or radio every person out there, but when you guys have these big kind of changes, I can't tell you how many people suffer out there, have no clue that they can go see a chiropractor. There's a lot of great docs out there that do a lot of great work and help a lot of people, but instead of like pushing in opioids and drugs, painkillers and narcotics on them, you know, simply going through and adjusting people and treating them with types of things that we did makes a huge difference in people's lives. It doesn't mean everybody's headache and neck pain and back pain always go away. It does not completely, but having that quality of life, you know, again, makes a big difference in there. So, guys, thank you for watching Warwick Chiropractic and Massage. If you know someone that's suffering with a headache, neck pain, back pain, and a number of other vertigo symptoms, tinnitus, get them to a chiropractor. It can make a difference. I'll see you later. Thank you for watching.